Hi there. I'm Angie Edson, and we are going to talk today about the causes of low back pain. So, lots of people show up at the doctor with different complaints, and statistics show that one of the highest frequencies of complaints that people show up with is complaint about pain, tightness, or achiness in the low back. And there's a reason why the low back is so susceptible to injury, tightness, issues of any kind. And we're going to go through a few of those reasons right now because I am super passionate about sharing all the information that I know. I used to have a really great doctor who, when I went to see him, he didn't just treat me with drugs and send me on my way. He was really passionate about sharing his knowledge. So he's gone to school for many, many years. And he was passionate about sharing his knowledge with his patients. So he would educate you when you go in to visit him. And I believe education is power. Knowledge is power. The more we can know about our bodies and what's going on with us, the more we know what's going on with us, right? So we have that knowledge. We can gain that knowledge. I'm going to share some of that with you here today. So the first reason why the low back So we're going to get to talking about some anatomy in a moment, and I might even pull up some pictures and slides here for us to talk about. But the biggest culprits of low back pain are inactivity, basically not moving, not walking. We get sedentary, we're not doing what the body is naturally designed to do, and that's going to cause problems in the long run. Sitting for long hours, huge culprit, right? Like sitting at the desk for 8 hours, your body's in that sort of forward flexion position for that long in the day. It's not designed to do that. The flattening of the low back, the lumbar curve, that causes a lot of extra undue pressure and strain on the low back. So if you're sitting in a slouched position with kind of a roundedness in the back, so say if you're sitting and you're leaning back in your couch just like I am now, and the low back isn't keeping its natural low back lumbar curve, this over time can sometimes produce a lot of pressure and wear and tear on the spine. And wear and tear is another one, simple age, right? So over time, the spine acts as a shock absorber. Over time, when we are walking, jumping, just the normal gravitational pull pushing down on the spine is enough to start to, over time, compress the discs just with gravity. So that's another reason. Poor posture, weak core muscles. So when the low belly muscles, the transverse abdominis is not strong as it's designed to be to support the low back, that can sometimes cause strain in the low back as well. So I also want to talk about the spine. Let me show you a little slide here. I think that will help us to explain it. Okay, we are going to have a rudimentary anatomy lesson here. Not to scare anybody, but I used to be totally disinterested in anatomy, and that has changed a lot over the years because our bodies are amazing at how they can heal and regenerate themselves. We do not give them enough credit. And the truth is that the body is designed to be constantly moving towards a state of balance or homeostasis. So whatever we're doing in our lives, whatever environmental factors are at play, whether that's our diet, how we're moving our body, or what we spend our hours doing in a day, all of that is affecting our health and well-being. So our goal is to, when we're healing especially, is to try to create the environment that is most conducive or most helpful for our body to naturally heal itself. Because it's always trying to do that. Despite all of the things that we do to our bodies, all of the garbage that we eat, and all of the lazing around watching Netflix that we do, it's still trying to be healthy and rebuild itself, including the spine. So I talked about the flattening of the lumbar curve. Let's just take a little tour here first through these two spines. So this on the left is the front view of the spine. This is the cervical spine up at the top. Then you've got the middle back thoracic region, and then you have the lower lumbar spine and the fourth section down here, which is the sacrum. This is the side view of it, and you can see the side view, how beautifully S-curved this is. Now, a healthy spine is designed to have this S-curve because just like a shock absorber, say in your car, this curve, this S shape, means that when you're walking and jumping, it's absorbing the pressure, the shock of your steps, right? So it's not jarring. It's not jarring you each time that you step. So your spine needs these natural curves in order for it to be healthy. If any of these curves, your cervical curve, if it's flattening out, if your low back curve is flattening out, that puts extra pressure on the discs. And it can sometimes cause bulged discs or herniated discs, especially when there's wear and tear over time. So it's really important with the low back that we maintain the natural low back curve. Different things that can affect that, like I mentioned, is posture. Even sometimes people standing with duck feet. You know, have you seen somebody stand with their feet turned out like this and their hips pressed forward? Oh, we lost our visual here. That will flatten the low back as well. So maintaining this natural lumbar curve. So if you're driving in your car, put a pillow or something underneath, especially if your car lumbar support is not working very well. You want to feel that that space behind the small of your back is filled up. It gives you this little lift, which allows your spine to be in this nice shape. It feels wonderful to have that support underneath the small of the back. So another reason why the low back is susceptible is, it's quite simple actually if you think about it. The head is like a bowling ball. It weighs several pounds. If you think about your head being perched up on top of the neck, the low back down here where it's attaching to the sacrum, it's carrying all the weight of everything that's above it. So there's more pressure on the discs at the bottom of the spine than there are on the discs at the top, simply because it's bearing more weight. It's bearing the weight of your head, it's bearing the weight of your arms, your shoulders, your torso, everything from your low back upwards is pushing down, pressing down on the discs. Now these little blue guys in between, the bones in between the vertebra, are the discs. They're kind of like jelly donuts, and inside there's some sort of jelly-filled substance that helps to create that sponginess, that spongy effect to absorb the shock. And so these discs are essential in keeping space between the vertebra, and we don't want them to be compromised. So another thing that causes the low back to carry the brunt of it is, you see this area down here I talked about, this is the sacrum. Now the whole part of this the spine from the sacrum up, it's very mobile. It bends to the side, it bends back, it bends forward, and it twists. So the whole rest of the spine is designed to move in all of these directions. The sacrum here, where it connects to the hip bones and the pelvis, it isn't. It doesn't have a lot of mobility. It doesn't have a lot of play. It does have a little bit, but it's designed to be stable because it's the connector between the spine and distributing the weight into the legs and the hips. So the place where the low back meets the sacrum, this last disc, the L5S1, L is lumbar, lumbar 5, and S is sacral, S1. This disc is the one that carries most of the pressure because this part, the sacrum's not able to move and work with the movement up here. Then all the movement gets put on here on the lumbar disc. So it's the torque is all on the lumbar discs, the L5S1 in particular. And that's why that's the most popular one to go, yeah. So if you've got L5S1 discs, join the party. Welcome to the club. It's not a fun club, but we're working with it. So the sacrum. The last part is the hips, right? So our hips are sometimes tight in the front of the hips, in the hip flexors, because we're sitting. And so the front of the hip is contracted for long periods of time. And sometimes the hamstrings are tight. So that can pull the pelvis out of alignment, which causes more pressure and undue strain on the back. So the pelvis is designed to be moving in a neutral and being able to swing freely forward and back. But if it's being pulled forward more by tight hip flexors in the front or being pulled back because the hamstrings in the back are tight, that translates into more pressure into the low spine. So you can see there's a lot of reasons why the low back is really getting it. It's the part of the spine that takes most of the brunt of our activities and non-activities of whatever it is we're doing. All right, so thanks for tuning in to my little anatomy lesson. Let's get back to it. So I want to come back to the first point that I made about the flattening of the lumbar curve, the lumbar spine. And I want to talk about how sitting in a slouch position is really, really not helpful for low back health. It's actually preferable if you're going to be sitting at home on your couch and lounging and relaxing. Instead of sitting in your easy chair and leaning back and just letting the belly be soft, it's actually a better idea if you sit in front of your couch with your legs stretched out in front of you. Shift your hips back so that you're right up against the back of the couch. You're sitting on the floor and your back is right up against the couch. And with that support of the couch behind your back, you could even put a little pillow, just a small size pillow like this, even rolled up or squished up underneath the small of the back, behind the small of the back. Now I'm sitting on my couch right now, but you hear me sitting on the floor and filling up the space of the lumbar spine, the curve of the lumbar spine. That's going to give you the support to be sitting up nice and straight. That's actually a better way to sit than lounging in your lazy chair. I know it's comfortable. I know you've had a hard day at work. I know it is. But really, sitting on hard wooden chairs where you can sit more upright and have the support from the hard chair is better than sitting in really soft chairs. So I really recommend that little tip is sitting on the floor, legs stretched out in front. You're also going to get a hamstring stretch there, which is helpful for maintaining back health. So that's the little tip that I wanted to share with you about maintaining the lumbar curve and keeping good posture. It's a little trick you can do sitting that way for several minutes each day. If you're watching your favorite show, watch your favorite show in that position. Make sure the low back is supported. Make sure your hips are shifted right up against the couch and your spine is nice and straight. All right, so the two things I want to share with you before we leave, there's kind of little bonus things. Next video, I'm going to talk about what the back needs to be healthy and what the back needs to heal. There's a few key elements to it. So one of them is reducing inflammation, and there's lots of ways we can do that. I'm going to share some of my lifestyle tips with you in the next video, and different ways that you can reduce inflammation. There's a lot of them, and that will help to reduce the swelling in the area. So there's increasing also oxygen and blood flow and circulation in the spine is very, very helpful for it as well. So I'm going to talk more about that in our next video and share a few more, maybe 9 in total, different key things that the back needs to be healthy. Okay, again, knowledge is power, information is power. We educate ourselves and use that information to get back to health and joy. So I think that's all that I wanted to cover today. Thanks for tuning in, and I will look forward to seeing you next time, and we will learn a little bit more about this. Okay, have a great day.